Hey guys, there's more and more talk about anaplasmosis as a more and more common tick-borne illness. What do you need to know about it and how do you protect yourself from it? So like Lyme disease, anaplasmosis is a vector-borne illness. We get it from ticks. Ticks will bite a rodent or a deer. They'll get the bacterial infection. It'll be inside of their bodies. It won't bother them. But when they bite us and start sucking on our blood and feasting on us, they're able to pass that bacteria over to us. It doesn't happen right away. This is really important. It's 24 hours plus for the tick to effectively transmit the bacteria that causes Lyme disease, and it's 18 hours plus for it to effectively transmit the bacteria that causes anaplasmosis. Unfortunately, the symptoms of anaplasmosis are pretty similar to the symptoms of Lyme disease, which are pretty nonspecific. It's a flu-like illness, so usually within a few weeks of the bite, people will feel fevers, chills, body aches, muscle aches, sometimes nausea, vomiting, which feels like any viral infection or even bacterial infection. So if you don't know that you've had a tick bite, you may not be thinking this, your doctor may not be thinking this, and it can be challenging to make the diagnosis. On the other hand, the treatment is not hard. If you know you have this, it's pretty much the same treatment as Lyme disease, which is 7 to 10 days of an antibiotic called doxycycline. The key is knowing that you might have this so that your doctor can do the appropriate blood tests to see if you do indeed have anaplasmosis. But prevention is, of course, better than treatment, so be aware of the fact that ticks are moving up more and more north in latitude. They're more and more active. Their habitat is growing as the climate warms up, so there's more and more chances for interaction with people and for us to get bitten. How do you prevent that? Well, you wear long sleeve shirts, you wear pants, you tuck your pants into your socks, your shirt into your pants. You wear light colored clothing so you can see those ticks on your clothes. If you know, you'll know you've been in the tick infested area. You also use insect repellent. So in Canada, you can get DEET, you can get icaridin. You can also get clothing that's been treated with permethrin if you do a lot of hiking. All of those are quite effective at repelling ticks. The other big one is to do a tick check when you get home. So remember, if you have a bite, not all is lost. They can't actually transmit the infection to you until hours and hours of being on your skin. So if you do a tick check after your hike and you identify the tick, you can remove it and prevent the infection. So you've got to do a close inspection of your clothes and of your skin. And if you see a tick, you've got to remove it. And so look up on YouTube, there's videos on how to remove it effectively without breaking it or disrupting it. Take a photo of it or collect it, keep it so that your doctor can see what kind of tick it is. The tick that transmits both anaplasmosis and Lyme disease is called the black-legged tick. If you have had a tick bite, if you're not sure how long it was on your body, within 72 hours of removing the tick, you can actually get prophylaxis for Lyme disease. But the key is to monitor for symptoms and to seek medical attention quickly if you have any of those symptoms of an infection.